I have two special guests and we are going to be discussing women health. We are going to be discussing on a topic that says creating a period in a friendly world. And of course, if you hear periods, ladies, you know what we mean. This means health for ourselves. And with me, I have Naomi Mutunji and I also have Esther Nakitende.
Yes.
From the Women's Probono Initiative. You are welcome, ladies.
Thank you so much, our dear host.
How are you doing this morning?
I'm well, thank you.
That's good. No traffic, no nothing.
The morning is
I can
good.
see we are glowing, so I know the morning is great.
Yeah, it is. It is a great one.
Yes. So today we are just going to be discussing something to do with our health as ladies, as women out there. And of course, this is about menstrual flow, our periods, and how, you know, we realize that there's not much awareness. We see school dropouts for the girls because of, you know, one or two, three reasons. So to start with, Naomi, first and foremost, how do you think we can even prepare ourselves, or rather should I say, how can we ensure that even as we go through this season, we keep ourselves healthy, clean, and you know, everything to just do with the menstrual flow at the end of the month?
Thank you so much. Yes, like you've introduced me, I'm Naomi Mutunji, a legal officer with the Women's Probono Initiative. The Women's Probono is big on women's health, women's rights, and equality. So internationally, in May, we celebrate the World Menstrual Health Day, Menstrual Health Month, actually. And we celebrate it particularly on the 28th of May. So tomorrow is the World Menstrual Health Day. So it's interesting that we are in studio today. And we celebrate it in May because May is the 5th month. And, you know, 5 days is like the average number of days for approximately a woman's menstrual cycle. So like locally here, our concern is really for a period-friendly world. And what do we mean? We mean a world where every woman and girl is safe, every woman and girl has access to information, and every woman and girl has an opportunity to manage their period with dignity, with equity, and in a way that does not hinder their life purpose. For example, if it's a young girl, it won't hinder her education. If she's a grown woman, it won't hinder her work life and productivity. Yeah, because statistics show, especially in our country, that the level of school dropouts are tagged to menstrual problems. Girls don't want to go to school when they're on their period, first because of stigma, taboo, and then sometimes the issues that come with the period. Sometimes someone may be sick, and sometimes they may not have access to hygiene products that make them comfortable during that time of their lives. Thank you.
Okay. So Esther, do you think that menstrual health is something that is talked about in schools and in homes? How do you think we fall in that as a country?
Thank you very much, dear host, for that very important question. First, I would love to recognize that in terms of the international level, because we draw our aspiration from what is already established internationally. So in terms of international level, we can assess and say that yes, we are having conversations about menstrual hygiene, and it is why we have this particular day on the 28th of May to celebrate a woman in terms of their menstruation. But when it comes down to the national level, we still have a lot to do as a country, down to even our families. Just imagine, in many hospitals and schools, they provide free condoms. But till today, we do not have a place that provides free sanitary towels for girls. And that is a very big challenge for our country, because Naomi has just made it clear that so many girls drop out of school simply because they do not have sanitary towels. More to that, very many girls are coerced into early marriages by men who say, I can buy you a sanitary towel every month. So as a nation, as a country, on a domestic level, we need policies to establish the need to have sanitary towels in schools. We can take examples of countries like Rwanda. In Rwanda, they have a room particularly for girls to help them wear their pads, change their pads. We do not have that in Uganda.
Yeah.
In Rwanda, they provide free sanitary towels to school-going girls.
Yeah.
We do not have that in Uganda. The latest problem that we have is the tax on the sanitary towels.
Yes.
Why would you tax a sanitary towel? Well, knowing that it is an equipment a girl child needs to have a healthy life.
Yes.
Even in workspaces, why don't we have leave for menstrual days? Because sometimes it's so bulky for you to keep at work while you're having cramps.
Yeah.
So as a nation, we still have a lot to do to ensure that we as women have a very comfortable place as we also do other things. Also to mention, in the aspect of culture, we still have people that think women are dirty and not worthy to have conversation when they're having their periods. They cannot enter a mosque to have prayers. The Bible makes it clear that women are dirty during their periods.
Yes.
They're not worthy to go to church. So as long as we still have such norms and myths that are not supporting the girl child during their periods, as a country, we still have a very, very big problem. And President Museveni made a promise to us that he will get rid of all the taxes. Till today, we have not seen any efforts towards that. We have the Ministry of Gender. We have the Ministry of Education.
Yes.
We need to bring all those people on board to ensure that we have policies that favor a girl child. We have female members of parliament. How about they legislate laws that ensure that the government has to provide sanitary towels compulsory and have that mandate? So as a nation, I think we are not doing so well, and that has really affected our girls and led to a lot of school dropouts.
So Naomi, Esther here has mentioned some of the policies, that the government can actually carry out to see that girls, all over the country have a safe menstrual cycle, even, during that time, safe and healthy and of course clean. What do you think other key stakeholders can also bring into that, besides the government? What do you think they can do to actually improve the menstrual cycle the menstrual health for the young girls in the country?
Thank you so much. I think other stakeholders will bring it down to the smallest units of the family level. If we can have awareness right at the family level, that every girl is told and taught about her body at a very early level by the people who matter the most. These are caretakers, caregivers. I'm speaking mothers, I'm speaking aunties and sisters, because in this country it is scary to realize that a girl can reach 11 years old and she does not even know that there is something called a period. Remember, we are now in a generation where puberty is happening much earlier than before. A generation before us, girls would start their menstruation about 13, but now we're hearing stories where menstruation is beginning earlier, by the age of 9 years. So if there is no this information and education at the smallest unit of the family, then it will become even complicated at the bigger policy level. So if the families can come together and educate these girls and create awareness at that level and prepare and train them, then later on it becomes an easier thing to deal with, and then we shall be progressing towards normalcy and indeed having a period-friendly world.
Okay. And what policies do you think should be implemented, in schools, in workplaces, and universities, basically just around the country to ensure that even as we go through this cycle, it's made comfortable for us?
Yeah, okay, first of all will be clean and safe water, bathroom spaces, provision of hygiene and sanitary care, and then of course dealing with that stigma and the taboo so that people are aware. That way at least girls are safer and they feel normal, and it's no longer something to be, let's say, ashamed of or something so strange, because it's normal ideally. Yes.
Then Esther, how can men and non-menstruating people be better allies for this cause?
Thank you so much for the question. First, I would love to mention that as Women Probono, much as we are a women's organization, we are an organization that encourages male participation in women movement. We are strong on positive masculinity to see that men also take a part in the women's movement. So then this brings me to your question, then how can we have men contribute positively to this period hygiene movement of women? First, men are people that we live with. My father is a man. My brothers are male. Just to give you an example, when I was my early teenage life, I lived with my dad, like from 14 to about 16. But my dad never had a conversation with me about periods. But I did not live with my mom. So no one, I didn't expect anyone apart from the father figure I had. So sometime back, about 2 years ago, I asked him, so Dad, where did you think I was going to get this information
from?
You are the only person that I had. I do not have a big sister. And his answer was, this is not a man's thing. It is a woman's thing. So it is very, very important that we have men engage in this conversation. So then how do we have men engage in this conversation? First, we have to encourage positive masculinity. The masculinity that perceives woman as important as men and acknowledges the challenges of the woman. Let's have this information shared to men as well. Let them understand the cycle of a woman so that he will not ask for sex when his woman is in her period. So that he will understand as a father when the daughter is having cramps. So that he will know the best sanitary towels for their wives or daughters. So the first thing is to engage men in the conversations of periods. The other thing is to empower men in all spheres. Women organizations should not totally get rid of men or neglect men. Involve them, bring them on the table, because men are very important, and if you do not, they become the abusers. So it is very important for us, one, to share with them the information as much as we are willing to share it with girls. In schools, the boys that shame girls because of periods, simply because they do not know that this is a normal thing. For example, if you had a male colleague that you work with, is he able to understand that today you cannot make it to work simply because you have cramps? It can only come to that point if you share with them the information. So two important things: bring them on the table when we are having conversation about menstruation, and also share with them the valid information. Let them know how many types of pads that we have, so that when you need an emergency of a sanitary towel, you can easily walk into a supermarket and get you one. Yes, so that is very important.
Okay, so now I want your thoughts on this, both of you. Having lived during this menstrual cycle, we have our days. So what do you think about that?
Thank you. I think because we are moving towards a period-friendly world and moving towards normalcy, I think if a woman can manage her period well, healthily, in dignity and with support, if she's not sick or unwell, because of course medical people tell us sometimes period time can be sickness time. There's something called dysmenorrhea, where the period is not normal. Someone is in a lot of pain, they really need medication, they need rest, they're having mood swings, then that is like sickness. They need to have leave. But if someone is just normal, I believe they don't need to have leave because of the period, because we are speaking about normalcy and a period-friendly world. They just need to be supported to have the right products for their care so that they are having their period in dignity. That is my thoughts.
Okay. And yours, Esther?
First, I would love to recognize that internationally, the world is moving towards recognizing period days as days that deserve a leave, stay back home and rest. Just like Naomi has said, it happens differently for every woman. For some women it's usually extreme, for others it's really just calm. But what is important, that this should be left to the woman to choose, to either take that leave or not. But it should be an open door for every woman. Because for me, sometimes I have the cramps. Sometimes I do not. So much as we are moving towards asking for leave on our period days, it should be our choice to choose. Should I take this leave or not. Because if we say that the employer should choose for me when I should, or should examine me until now, this one has intensive cramps and this one does not. How about the days when I do have them? So the choice should be totally left to a woman to choose whether to take that leave or not, but that leave should be provided.
Okay. Now, our final question, I think this will go to you, Naomi. How do you think we can make it easily accessible for, people, or rather ladies and young girls, especially those who are not able to access sanitary towels? How do you think we can make it accessible? And not only as the government coming out to help or initiatives, but as a whole, as a nation, how can we make it much easier for young girls in the villages to be able to access the menstrual products?
Thank you so much. Esther, I think, has spoken about the tax on menstrual hygiene products being so high. I think that needs to be cut down so that the cost is affordable even for an indigent person or someone of the daily life, right? Then if we speak about the rural girl, initiatives for making sanitary products that are reusable can come into play. There are many organizations which are doing this, and they're doing quite a good job of training, let's say, girls and maybe associations to make menstrual hygiene products that are reusable, so that even the girl in the rural area can manage her period time and hygienically with dignity, with access to such products. Then for those that the products that are on the market, that the tax will not be so high, so that they are not so expensive to afford. Yeah, those are my thoughts.
Okay. Now, just to wrap this up, what can we tell our dear viewers out there? We start with you, Esther. Just our parting shots.
Just one thing that I need to remind everyone, women and men, is that first, for the young girls and the boys, periods are really very normal. There is no problem with having that blood come out of you. So young boys in school, please stop laughing at girls. The best thing that you can do when you see your classmate that is female, when they've stained their dress or their skirt, is to cover them with a sweater. Do not laugh at them. So for the ladies out there, it is very important that even when you're having your menstrual cycles, you keep up with the hygiene. Because if you do not, you are likely to get infections. But for people that cannot easily afford pads, we have initiatives at Women Probono where we teach ladies to make reusable sanitary towels. Please follow up with us. We shall be teaching communities on how to make sanitary towels. For the government and policy makers, women MPs, please advocate, legislate on period hygiene in Parliament, because we trusted you and we trust that you can make laws and policies that will favor a girl to keep in school even when she is having a menstruation. So those are my parting shots, and I believe that the viewers have taken it in good heart and will surely act upon them.
Indeed. Naomi?
Thank you so much. So my parting shots on this topic is the issue of awareness at the smallest unit, the family level. Girls should be taught as early as possible on their sexual reproductive health. They should be trained on how to care for themselves. Then stakeholders to prepare accessibility to menstrual hygiene products in a way that does not drain the community's income. So those are my parting shots on this day that we celebrate period-friendly world. Thank you.
Thank you so much, Naomi and Esther.
Thank you.
And of course, you heard it from the two beautiful ladies over here from Women's Probono Initiative. Now, of course, we were discussing creating a period-friendly world. And of course, this is a topic that may have not been discussed so much in schools, and I think it's we are taken up to task to be able to, give more awareness and sensitization here for our young girls in schools and, even in different areas. But yes, we have come to the end of the show. It's always a pleasure to serve you here every morning. It's time for me to say goodbye, but do stay tuned because we are having issues at hand coming right up next.